Thank you for coming to our poster, Importance of Patient-Provider Discussions about Oncology Dose Optimization. I'm Martha Carlson, and I'm a patient member of the Patient-Centered Dosing Initiative, which is affiliated with the Metastatic Breast Cancer Alliance. This poster is all about patient-centered dosing for people living with metastatic breast cancer. It's an important idea in care that can mitigate side effects, improve quality of life, and allow continuation of a current treatment. I'd like to start with a little background about the PCDI and personalized care. So most individuals diagnosed with metastatic breast cancer remain on treatment indefinitely. Meanwhile, many oncology drugs were developed using the maximum tolerated dose premise that the higher the dose and toxicity, the greater the efficacy of the treatment. In oncology, the recommended starting dose is often based on the maximum tolerated dose, even though approved lower doses may be just as effective with less severe side effects. These side effects can result in patients needing acute care, missing scheduled treatments, experiencing a degraded quality of life, and potentially having fewer treatment options. To understand these consequences of treatment-related side effects and some of the strategies for alleviating them, the Patient-Centered Dosing Initiative conducted separate anonymous surveys of people living with metastatic breast cancer and medical oncologists who treat individuals living with MBC. Among our findings, 86% of the 1,221 MBC patient survey respondents, yes, that's a large number, reported at least one bad treatment-related side effect. Of those, 20% visited the emergency room or hospital, and 43% missed treatment. In contrast, the 119 Patient-Centered Dosing Initiative Medical Oncologist Survey respondents underestimated the prevalence of metastatic breast cancer patient side effects at 47%, but also they underestimated the acute care visits at 15% and missed treatments at 37%. This difference reveals a stark discrepancy in patient experience versus oncologists' understanding of how treatment-related side effects affect our lives, but it also provides an opportunity for more personalized care. So what is patient-centered dosing? Patient-centered dosing begins with frank and ongoing conversations between the healthcare provider and the patient before and during treatment. With our medical advisory board, the Patient-Centered Dosing Initiative created criteria that can inform shared decision-making about personalized dosing. These criteria include things like personal wishes, age, health, at-home care, and history of side effects. Patient-centered dosing is never the patient changing their dose on their own, and the PCDI cautions that patients should never change anything about their treatment without talking with their healthcare team. Why consider using patient-centered dosing? The PCDI surveys revealed opportunities to explore options, address side effects, and individualize care. Over 90% of both patients and oncologists surveyed are willing to discuss flexible dosing options. Many of the patients and most of the oncologists surveyed do not believe that a higher dose is always more effective. Importantly, of patients who received a dose reduction, 83% reported feeling better. and 77% of the oncologists responded that patients given a dose reduction felt better and that efficacy was similar to the standard dose. So how can the PCDI help you bring patient-centered dosing into your own practice? In this poster, we outline a 3-step action plan. Step 1, communicate. Initiate conversations with patients about side effects at every visit and discuss ways to alleviate those side effects, including patient-centered dosing. Step 2, personalize. Understand each patient's unique needs and characteristics, making sure to monitor quality of life and appropriateness of therapy and dose. Step 3, collaborate. Engage in shared decision-making about dosing before and during treatment. The PCDI has developed downloadable tools that form a framework for patient-provider collaboration. You can find these tools at therightdose.org, on mbcalliance.org, or by scanning the QR code right here on the poster. Thank you for stopping by.